Today on the 31st Foundation Day of Central Calcutta Society for Advancement of Human Resource and Development organized a national symposium with collaboration with the departments of microbiology and biotechnology of Sister Nivedita University, wherein the topic of discussion was on cancer, where many dignitaries came and spoke on that. Let's hear it out from them.
The biggest challenge that as I discussed is that the relapse after treatment and late detection, late diagnosis. Okay, once the tumor has grown to a great extent and if it has metastasized, then it's very difficult at present to manage those kind of tumors. But if it is kind of an early stage or in the middle stage, now it is possible to manage that cancer in very well.
The major issue in cancer is because you classify patients based on which tissue the cancer is being born, right? But it's now clear, as you already learned from some of the talks, that there are so many different patients. So there are patients and there are patients. And so some patients will respond to one drug, another patient will respond to another strategy. Now the problem is, for clinicians, we don't yet have a rider from the very beginning what kind of therapy to choose. And so that's the major issue.
But I think you have to make the speakers know that there are general populations are also listening to this talk, so that they can make the things little simpler, so that they can understand, the general population can understand the things. So that is very important, because in scientific we talk about very high-fi science, and they may not be able to understand that thing, right? So that is required in a simple language to get the message across.
Cancer, is a problem that we have not solved. There are a lot of efforts worldwide going on, but so that these are, whatever we do in biology is try to understand the cancer. It's like 6 blind people trying to visualize an elephant. But what is important in these meetings is that all of these 5 different views are put together, and that can give rise to the unification of the views and viewing of the elephant, so that knowing the elephant we know how to solve it.
So what I feel that these symposia are very important, particularly the youngsters. Like there are different topics on a particular disease, majorly cancer, which is probably every student is facing one or the other way in their family or the friends, etc. So all the new avenues of cancer are very important. So I believe this symposia would be very helpful for the next generation.
Yeah, of course. Any symposium where scientists of future are present, that's where I usually come, because it's better not to be in an echo chamber. When you are in the echo chamber, your peers are talking, so your knowledge is limited to what is already known. But with the future scientists in the room, there are possibilities that they will actually take motivation and think of very new out-of-the-box concepts.
The speakers today gave an insightful knowledge about cancer on today's session of National Symposium. With camera person Tanushka, this is Anisha, the SNU Chronicle, refreshingly different.